Hello YouTube! Just wanted to give an update on my heart surgery. Since I got a comment on my June channel update about what's going on with my heart surgery. So, I'll read out a discharge referral that I got after I just tell you. So, my heart surgery was supposed to be August 12th. So April 12th, sorry. I went to hospital in March in Sydney to get testing done with my cardiologist at her hospital. She did the testing and said I needed surgery. And if I didn't get it, I'd only have possibly 10 years to live, basically. So I agreed to get the surgery done, and it was supposed to happen April 12th, which is when I wanted it done, because my surgery would have been done in time for me to move to Brisbane in July. Would it give me enough time to move, to recover for the 3 months, and then move to Brisbane. But when I went in for pre-surgery, or pre-admission, which was a day before, the cardiothoracic team that was going to do my surgery didn't speak to the hematologists until the afternoon. They didn't know that I existed, basically, until the afternoon before my surgery. Because I have hyperfibrinogenemia, they needed to do extra testing to find out whether my hyperfibrinogenemia was bleeding or clotting, or there's different types of hyperfibrinogenemia symptoms, and they needed to work out what medication would be best to help me during surgery, what would be best for my surgery, to any medications that I'm on, make sure that everything was perfect for my surgery. So because of that, they pushed the surgery all the way to May 24th. Now keep in mind, you need 3 months to recover from surgery, right? Which would have ended up being August 16th. August 16th, basically, would be the 12-week mark, or the 3-month mark. And thus, within that 3-month mark, I would have been moving, so the 6-week mark, because we're going to cut down my sternum right here to get into my heart, to fix the hole in my heart, which would have been a open heart surgery, basically. And there would be, let me get into it. I'm trying to think. Yeah, and I would have spent at least 3 weeks in Sydney, minimum, to make sure that I was okay to come back home. Now keep in mind, the property I'm in at the moment has a driveway that's 30 degrees. I don't know if that's 30 degrees, but it's 30 degrees, very steep to walk up. When I take the bins out, I lose my breath taking the bins out, basically, to the point where I've got to sit down afterwards. And keep in mind that there's 17 stairs I've got to walk down to take the bin down, and then I leave my bin out there for a week because I can't bring it back the day after, because doing this just takes everything out of me, all my energy out of me. I've got to sit down for 10 to 15 minutes, if not longer, to get the bin taken down. After I take the bin down, it takes me about 10 to 15 minutes or longer to catch my breath, make sure there's no pain before I can do anything else. And that's pain in my chest before I do anything else. That's because I walk up and down 17 stairs. I was at 17, 18 stairs. And walk up and down a 30-degree angle driveway. And it gets steeper as you go down to the road. So I'm not making up anything here. I can't even walk 5 minutes at the shops. I literally cannot walk 5 minutes at the shops without having to sit down. So I'm not making anything up. And I looked at the dates from May 24th, and that would have been 6 weeks before, 6 week mark would be 5 days before I moved. You cannot legally drive a car until the 6 week mark. So 5 days after that 6 week mark, I'd be moving to Brisbane. So there's no way I could have moved to Brisbane in July if I had the surgery on the 24th, which is today, I believe it was, or yesterday, depending on when this video goes out. And my lease for this property that I'm in Coffs Harbour, ends on August 12th. So, even so, that would have been 4 days extra I would have needed somewhere. I would need to stay somewhere for an extra 4 days to recover from this surgery. So I still would have had to have packed everything. Excuse me. I still would have had to have packed everything, cleaned the house, and all that so I could move. And now that excuse me, let me just think. Now that I'm having a surgery in Brisbane, I spoke to my cardiologist about this, and she wanted me to have the surgery because she was worried that while I was in Japan, if I had the surgery in Brisbane and had it after Japan, she was worried that I would get arrhythmia. I don't know for sure what she called it, but she said I get an arrhythmia attack, which is basically going to cause me to get a blood clot, which would lead to a stroke and could lead to me dying. So I came to a decision with her that I'd had the surgery in Brisbane after I went to Japan, because I'm going to take it very easy in Japan. And then I had the surgery after. She set me up with a new surgeon, a new cardiologist and a surgeon in Brisbane, which I haven't spoken to yet, but yes, I haven't spoken to any of them yet, but that worked out because I could move to Brisbane. And then 1 week ago, I spoke to my new landlord at the new place in Brisbane, at the place I'm moving to in Brisbane, and he said I could move in earlier, so I can get the keys on the 10th of June, and I got my removal set for delivery on the 13th of June. So I'm moving to my new house, to the house in Brisbane, where I'll be close to my family because they live in Queensland, and it'll be cheaper for them to come to me for the surgery rather than going all the way to Sydney. And I'll be able to, I'm only 15 minutes from my cardiologist's hospital, I should say. and I'm probably not that far from where they're going to do the surgery anyway. So it works out better for me to get the surgery done in Brisbane, because after the surgery, if the surgery is done in August, I've got 3 months. So after I come back from Japan, I've got 3 months to recover. 3 months free that I can recover. Yes, I'll try to still stream if I can, because I set up the place so that I can stream by sitting on a chair and whatnot. But I've got 3 months to recover from the surgery, and I get the 3 months free after the surgery, after Japan. So it works out perfectly. And I'm moving early just in case the cardiologist has to do any testing, which I don't think he will, but he might. And there was no way around doing any heavy lifting. Now, with my packing and my cleaning, there is no way around anything to get the house cleaned, because, yeah, you don't need to know this part, to get the house cleaned and for me to pack for my move. So the cardiologist was not 100% happy that I postponed the surgery to August at this stage, but she understands that I had to be done. Now, this is from the Royal Prince Alfred Hospital in Sydney. This is my discharge referral, so I'll just read it to you. I'm not giving out any details. Presenting problems. Admission summary. Presenting problems. Elective admission for pre-operative workup. Principal diagnosis. Large partial atrioventricular septal defect. Complications and comorbidities. New or requiring change to treatment? None, because I had no treatment before this, and I was diagnosed in December. After I came back from New Zealand, so it was a big shock. Continued care recommendations, basically, I don't need to know that. Anything that says any personal information, I'm not going to say it. Clinical history. Summary of process. Thank you for your outgoing care of me. Admitted under cardiology at Royal Prince Alfred Hospital on the 5th of March. Did you know I went to Brisbane? Went to Sydney for it. And on the 12th of March was when I got out of hospital. As you all know, because that week was full of shorts. It was right after I finished Pikmin 2. Was it Pikmin 1? No, it was Pikmin 1. Pikmin 2 was before I went to surgery. For pre-operative work up for surgical repair of large partial atrioventricular septal defect. This is on a background of obesity, autism spectrum disorder, and haemophilia. Hyperfibrinogenemia, but they don't have it here. Low fibrogen. 9 to Professor Rachel Cordina, who was my cardiologist in Sydney. For a summary of outcomes of the pre-op work-up, please see the issues listed below. So the plan was to discharge me from home.
I'm sorry, I didn't quite catch that. Could you please say that again?
Hold up. So the plan was to discharge me home. Preoperatively will require chlorhexidine mouthwash for 3 days preoperatively. It's just a thing to a mouthwash, which they never said I needed because it was too late to have it. When I went to Westmead Hospital, they told me it was too late to have the mouthwash. Follow up. Local dental practitioner review, yeah, that's fine. Ongoing, yeah, that's fine. It's just podiatry care. And I need a local dental practitioner. Telehealth review with clinical geneticist Dr. Malawawa Chichi. Sorry, I can't pronounce it. For follow-up of genetic testing in several months' time. So I'll get a follow-up on that. Refer to obesity and metabolic syndrome clinic for ongoing follow-up. Look, if you really want to know, I'm 100 kilos. And I'm 5'3" or 156 centimeters, I believe, or 153. I forget exactly how tall I am. But yeah, BMI says I'm obese. I am obese. But it's like, so what? Someone with muscles, who's 5'3" with full of muscles basically, puts on weight because of muscle. Just because I don't trust BMIs, by the way. That's what I'm trying to say. Please continue to take multivitamins and eat healthy food. Yeah, about that. Issues. Pre-op workup. Transthoracic echocardiogram. Partial atrioventricular septal defect with bidirectional shunting, likely due to raised right atrial pressure rather than severe pulmonary hypertension. The atrioventricular valve worked reasonably. Cardiac MRI. Sleep study, no significant sleep disorder breathing. Moderate and REM sleep. Genetic testing, seen by clinical geneticist, awaiting chromosomal microarray and further gene panel if normal. Neurocognitive assessment, which was done. Dietitian review, plan for multivitamin and referral to obesity and metabolic syndrome clinic. I never saw a dietitian. They organised a x-ray of my mouth around here just to see how my teeth were, and they said the x-ray was booked out for quite a while, and then suddenly they said, we've got it booked for you, we can go and we're taking you now, and the dietitian showed up while I was out getting the x-ray. Dental review. Basically, I don't have money to eat healthy. I've got money for frozen foods, but I don't have money to eat healthily. And no, it's not because I spend money on games and stuff like that. It's because I'm on a disability support pension, which basically is like $1,220 with rent assistance, and all that, all the little extras per fortnight. So I do what I can to survive. Where are we? Dental review, poor oral hygiene obviously, whatever, I'm not going to say that. Thick plaque on teeth, gingivitis present, no obvious calculus, caries, swelling, tenderness on mobile teeth, overall dentally fit for surgery, however would benefit from chlorhexidine mouthwash for 3/7 prior, 3 out of 7 days prior with at least daily brushing. Podiatry review, neurovascular assessment normal, nails trimmed. I had to say because it's on here. Cardiopulmonary exercise testing, poor exercise capacity with poor spirometry, apparent reduced FEV1 and FVC, CPET lung function testing, dental report, cath report, first letter. That's never mind, not going to read that name. Where are we? No. Multivitamins, can't have any over-the-counter options, so that's fine. This was done back in March, by the way. CardCath. Most of you would not know this, but what this says, but I'm just not reading that. No, it's on the next page. Height, it doesn't say my height or weight there. Hemodynamics. So my hemodynamics, heart rate is 103, rhythm is sinus. RA is A equals 13, V equals 1 is 12, M equals 11, and RV is 22 over 0, A equals whatever. PA is 35 over 14, M is 22, PAW, or PAW, A equals 15, V equals 14, M equals 11. Other precious comments. CO thermodilution 6.29 liters per minute. FICK thick 6.4 liters per minute. PVR 1.7 wood units. So my oxygen saturations were SVC 69%, IVC 64%, atrial 87%, PA main 93%, RA mid 73%, RV 81%. Angiography, which is what I had, which I thought I would die from while I was in Sydney. They have left ventriculogram, ventricular graph was not performed, but they can't tell you anything right here. Complications none. Final diagnosis, pulmonary hypertension, which it said that I don't have, but it says here. Mild pulmonary hypertension with normal cardiac output and PVR 1.7 wood units. O2 sat steep up in RA, RV, and PA, consistent with known atrial ventricle septal defect. So that was done there. What's next? Non-theatre procedures, pulmonary report, patient details, I'm not going to read that. Height 157 centimeters apparently, so there you go. My weight was 98 kilograms for this. My BMI is 39.8, so I'm not quite morbidly obese, but I'm obese. Nocturnal polysomnography. Is this a sleep one? Occasional occasional Hypopnoic respiratory events noted, predominantly in REM sleep. Basically, I don't have sleep apnea. Sleep studies report. Alright, so medical imaging. Where are we? Just trying to figure it out. Yeah, that's fine. Indications: AV septal defect, unrepaired, which they're going to repair in surgery. Study data: heart rate 90 beats per minute, rhythm, sinus. Procedure: image quality was fair. The study was technically limited due to body habitus. Satisfactory imaging could not be obtained from the subcostal acoustic window. Left ventricle cavity is normal. Wall thickness is normal. Cystosolic function is normal. Right ventricle, the cavity size is moderately to severely increased. Wall thickness is increased. Systolic function is normal. Left atrium is normal in size. Right atrium is normal in size. The ventricle septum appears intact. Atrial septum. There's a large premium atrial septal defect in the baseline state. There is a bidirectional shunt, which means I need to fix that. That is what I'm going in for surgery for. But it's been pushed back. The valve, aortic valve, the valve is tricuspid. The cusps are normal thickness. Cusp separation is normal. Aorta, aortic root. The root is normal sized. Ascending aorta, the vessel is normal sized. Normal size for the arch of the aortic. Mitral valve, left atrioventricular valve. The leaflets are normal thickness, leaflet separation is normal. There's no significant regurgitation, Tricuspid valve, right atrioventricular valve. The leaflets are normal thickness, leaflet separation is normal. There is trivial regurgitation. Pulmonic valve, the cusps are normal thickness, cusp separation is normal. This video will probably go for a little bit longer, but you know. You wanted to know what's happening with my surgery. I'm letting you know that I'm going to have surgery. I don't know when it's going to be. Possibly in August. At this stage. But I'll let everyone know later on when it's going to be. When I find out anything else, I'll let you all know. Systemic veins. Inferior vein cover. The IVC is normal sized. Vessel collapses more than 50% during inspiration. Perpendiculum. So, pericardium. The pericardium is normal in appearance. Conclusions. Partial atrioventricular septal defect with bidirectional shunting, likely due to raised right atrial pressure rather than severe pulmonary hypertension. The atrioventricular valve work reasonably. So the MRI is the pending result. The microarray and the XR OPG. The pending results, by the way. And that is my discharge letter from RPA, Royal Prince Alfred Hospital in Sydney. So basically, I need surgery. And I need surgery ASAP. But, which is what I had set up in April. Whoops, because in April, because when the surgeon rang me, they basically said, when would you like your surgery? And I said, April 12th, because that's the date I could do it. Get in hospital, get out of hospital and get ready for my surgery. Get ready for my move. Whoops, sorry. I can't lift anything heavy after the surgery anyway. So I would have been okay to go to Brisbane in July, because I would have been the 12-week mark. It is not my fault the surgery was delayed. The surgery was delayed because the cardiothoracic team at Westmead, the people who are going to do the surgery, did not talk to the hematology department, until the afternoon before. Literally, that afternoon they spoke to them, and they needed extra testing done before they could actually go ahead with the surgery. So they said no to the surgery to the surgeon and to the cardiothoracic team, and that was delayed until May 24th. Then a few weeks later, I realised that I couldn't do the surgery on May 24th because I had to get everything ready for my move to Brisbane. And so I spoke to the cardiologist, and she was against me not doing the surgery on the 24th, but she realised that I couldn't do any recovery at the house I'm in. I couldn't walk down the stairs to go to appointments that I would need, like rehabilitation exercises and whatnot after the surgery, and it would be hard for me to go do walking and all that, and going downstairs and going upstairs and going down the driveway and up the driveway. It's just impossible. So she agreed with me that she would put me on to someone in Brisbane for the surgery, so the surgeon and the cardiologists, and she would stop being my cardiologist for now, and that way I can move to Brisbane, go to Japan, even though she was against me going to Japan, because she thinks I'm going to have, let me just get this for you. Hold up. She sent me an email a few weeks ago when I talked about it. Whoops, wrong one. It should be over here. Yeah, a few weeks ago she sent me an email. Not Rachel. Talking to myself. She said here, "Hi John." Oh, so, hi. It is my strong opinion that you should have surgery as soon as possible. There is a high chance that you are going to atrial flutter and end up very sick while travelling. And I'll be very happy to help you coordinate, whatever. So she basically said I could have an atrial flutter. She said, okay, we will redirect your referral to the surgeon at Prince Charles Hospital, and I will ask my lovely friend to take over from me as your cardiologist. Haven't had anything back from either of them. Yet. But if you want to know what an atrial flutter is, A-T-R-I-A-L-F-L-U-T-T-E-R, atrial flutter. A condition in which the heart's upper chambers atria beat too quickly. Rapid contractions of the upper chambers of the heart may spread to the lower chambers, resulting in a rapid heartbeat. Although atrial flutter is usually not life-threatening at first, it does limit how well your heart pumps blood. This can cause a clot to form in your heart. If the clot breaks loose, it could lead to a stroke. Over time, atrial flutter can weaken your heart's muscle. And atrial flutter is similar to atrial fibrillation, a common disorder that causes the heart to beat in irregular patterns. People with atrial flutter have a heart rhythm that's more organized and less chaotic than that of an atrial fibrillation. Sometimes a person may have episodes of both flutter and fibrillation. People with atrial flutter may not have symptoms. However, the disorder can increase the risk of stroke, heart failure, and other complications. There are effective treatments for atrial flutter, including medications or procedures, yada yada yada. So basically, I could go into atrial flutter and die if I do not have the surgery. So that's why I'm moving to Brisbane as soon as I can, so I can start the ball rolling on getting the surgery. Because, as it is, I got to travel on a train for 9 hours to get to Brisbane, to get to Sydney, from Coffs Harbour. That's a 9-hour train ride. And then there's no way of me getting back to Coffs Harbour for 3 weeks, minimum. And that's if I have someone with me who can go on the train with me. Otherwise, it's 6 weeks until I can catch a plane to Coffs Harbour. And that 6 weeks would be 5 days before I move, if I had the surgery on the 24th of May. As I said, it was not viable for me to have the surgery in May. So at the moment it's postponed until August. That important message video I have will premiere the day I have my surgery. So keep checking that video in my premieres for the date of the surgery. At the moment, it's set to a placeholder date in August. So we'll see what happens, and I'll let you all know as soon as I know anything else. Okay, everyone. I'll see you all in my next video, which will be the PlayStation Showcase tomorrow, or the PlayStation Showcase in about 5.5 hours. Okay, everyone. Bye.